Okay. What we're going to treat on Robin today is some little facial telangiectasias. This is a very common spot, as you can see, especially the ones that are adjacent to the ala, the cheeks as well. And I found a very useful device to be the Elman radiofrequency ablators, if you will. I use a very, very thin wire that they provide for this. And they have several machines, models. They all do a very nice job of doing a radiofrequency ablation of these facial telangiectasias. You can tap out some that works especially well on the face, but sometimes you can also do them on some little spider veins that are really refractory in other areas, such as the legs. I do think even under the eyelids you can be very careful and perform this. But some patients are also even resistant. If you use a YAG laser, they can be very resistant to it. And I found this is a totally relatively painless procedure, and I think it's very effective as well. So the settings on the Elman AccuSect are using the monopolar current, and I set that a little bit higher in terms of the current. I set it at about a level of 2 to 3. When we use the dual, I set it on 5 again on the monopolar current. That's a combination cut and coag. I've been using this technology for at least 19 years, and I think it's a nice self-contained unit and also, again, very successful. And people can come in and really have very minimal redness afterwards. They can really put some makeup on about an hour later and go about their business. So if you look right here, hopefully you can see these demonstrated. These little, small, very fine telangiectasias. And you can see that in terms of treatment, I am compressing it. What I do is it's a very sensitive area. I barely puncture the skin because that's where these live. And you kind of trace them out. You doing okay? Mm-hmm. I use loop magnification a lot of times for these very, very small ones. And you really, essentially, you're getting inside the little small telangiectasia, little vessel, the capillary, if you will, and it really just coagulates these little endpoints. It can be a little bit sensitive. That's a really sensitive area. We just used topical to anesthetize it. I think it's pretty tolerable, but we'll ask Robin, and she's not trying to hit me or anything yet, so I think that she's seems to be doing okay with it so far. You can even break out and come a little further along the sides. You can see there's a very, very fine wire that I'm using. Very quick and easy, nice use of this technology. Just so you know, Robin's had some filler and neurotoxin today, but it also illustrates that this is a nice little quick add-on procedure that you can do in combination with other things such as fillers and neurotoxins all at the same sitting. It really doesn't add anything to any minor recovery time. In fact, Robin will be going out later tonight. So we're just going to tap out. You kind of see this little bigger spider vein, little telangiectasia there. It does smart a little bit, but they really seem to tolerate it pretty well. Can you see that? It really has disappeared very nicely. Just a little time and patience there. But that's really done very well. And I can tell you, I've had these done in a very sensitive area. And especially if you're trying to laser these areas, that's really, really uncomfortable. Robin's being very good. I won't lie, it is uncomfortable, certainly, but compared to some other methods of addressing these, I think that the pain is less. And you can see this just a really immediate result with almost no erythema, no to minimal, I will have to say, actually. Nice part is you can be just barely beneath the surface of the skin with this very pointed wire, if you will. All right.